There is a new minimally invasive approach to treating patients with limited choices for heart valve repair. The procedure allows for improved blood flow without the need for extensive surgery. And here to tell us more is Dr. Parminder P. Singh. He's the Cath Lab Medical Director at Banner Australia Medical Center. Welcome to the show. Good to see you, Doctor. Thanks for joining us. We're talking about aortic stenosis. What are we talking about?
So aortic stenosis is one of the most common conditions in older folks who are 65 and older, where there's a valve in their body which is so tight that the heart is unable to pump the blood freely into our body. And it is one condition which is increasing in prevalence over the years in our elderly population.
Do we know why increasing prevalence?
It is mostly because we're aging.
There's more old folks.
More old folks.
So symptoms would be what, like shortness of breath, that kind of thing?
Yeah, the most common three symptoms are shortness of breath. Many patients feel chest discomfort and tightness, fatigue, tiredness. Sometimes they can pass out. And it can manifest, those are common symptoms. Many patients will try to just get back their activities over time.
Yeah, but can lead to heart failure and death, I would imagine.
It can lead to heart failure, and if you don't fix it, 50% people die in 2 years.
Really? All right, so replacement, I would imagine, is an option. How often does this lead to replacement?
So the prevalence is about 3% of the population above the age of 65 have aortic stenosis. And so as you see, as people age, we see more and more of this condition. And we grade the aortic stenosis mild or moderate or severe. And once you go to a severe stage, you have to fix it mechanically. There's no medication which can fix it.
Right, right.
And so a lot of patients will have fatigue, tiredness, symptomatic. But some patients just wind down, they become less active, and people think they're fine, but their activity is cut back.
Yeah.
So it's important for them to seek out the cardiologist or their family doctor if you notice they're tired, short of breath, or they're having chest discomfort.
And this is where TAVR comes in. What is TAVR?
So for many years, the only way to fix the aortic valve was to do open heart surgery. Midline incision, and then you put a new valve inside and clean the old valve out, put a new valve inside, and suture it in. For the last 10 years now, we have this technology, almost 12 years, where you can go through a big artery in your groin all the way into the heart and put a valve inside the old valve and deploy it in such a way that patient can be discharged within 24 hours.
Really?
And they can go home the next day.
My goodness, great. I mean, is that, and that's common?
It's very common condition. In average in US right now, we do about 100,000 to 120,000 valves every year.
So minimally invasive, and now does it sounds like it replaces the valve, kinda? Does the old valve stay in there?
The old valves acts like an anchor. So there's calcium in the old valve, and the new valve goes inside the old valve, and once you deploy it, kind of holds it in place.
So you can move around the same day?
You can move it on 4 hours later,
Yeah.
and we send the patient home the next day.
Wow.
Unlike when you had open heart surgery, you are in the hospital for 5 to 7 days.
And complications more likely with the open heart surgery?
Absolutely. The risk of stroke is higher, infection stroke risk is higher, and the only risk which is similar is risk of pacemakers sometimes.
Yeah. Now, as far as blood thinners, we mentioned stroke, blood thinners, how do they play into all this?
Usually most patient requires aspirin and then a pill called clopidogrel or Plavix. There are blood thinners to make sure the blood stays thin.
Yes.
We also want to make sure these patients take antibiotics if in case they have any infection or dental work done, stuff like that.
Interesting. And how long do they stay on that medication?
3 months. Aspirin is for life.
Yes.
But the Plavix or clopidogrel for 3 months.
Interesting. And this has been going on for like 10, 12 years now.
It has been going on for 10, 12 years, but for the first time, we are bringing this to the west side of Phoenix, to West Valley area at Banner Australia, and to help our community on that side.
Are there risks? You mentioned risk factor here for open heart surgery. TAVR, risk factors?
So age is number one. Some people are born with the 2 leaflets instead of 3. We call it bicuspid aortic valve. So there's an abnormal physiology when they're born. And many of those people will get disease in the 50s and 60s. And some end up getting disease in 70s. But the most common risk marker is age and some predisposition.
So with that in mind, last question here. Who's a good candidate? Who's a not so good candidate for TAVR?
So anybody who's older than 65, and even some patients under the age of 65, but 65 and older, definitely 70 and older. The oldest patient I've done is 93-year-old.
Holy smokes.
And he went home the next day. This transaortic valve replacement, it's like one of the amazing procedures I've seen where you can fix the valve and send the patient home the next day, and they feel so much better. They can walk more, they can breathe better.
Yeah. Well, this sounds like great stuff here. And I mean, the medical advances we do on the show all the time, but it's just amazing how far these things go. Yes. Congratulations on this. Best of success out there at Banner Estrella. It's good to have you here.
Thank you so much.